Guys, how you doing? I hope you are doing fine. Well, in this video, I'll be discussing counseling structure. I'll be discussing counseling structure. First of all, before I go to counseling structure, I would like you to know what is the meaning of counseling. Dr. Mo, what is counseling stations in the exam? What is the meaning of counseling station? Counseling station is a station that is already diagnosed. So the station is diagnosed. The station is diagnosed. The patient knows about his condition. However, he's coming today because he has a concern. He is concerned. He is concerned. So don't forget, counseling equal, what is the first letter in counseling? C. Equal concern. Equal concern. So counseling equal concern. C and C. So don't forget that in counseling station, you need to know the patient to concern, because counseling station is diagnosed station, a patient who knows about his condition, a patient who is epileptic, a patient who is diabetic, but today he's coming because he's concerned about something. Counseling concern. If you approach a counseling station without asking about the patient to concern, you have had it. Okay? So counseling equal concern. So now, what is the counseling structure? In order to give you the counseling structure, first of all, we will discuss in the following videos all about counseling stations in details. However, today I'd like to give you a structure about counseling station. What is counseling structure station? So I will give you an example from plab 2. Then we can discuss it. We can apply this example on the structure. Then you will reach your structure and you will have a map. Okay? For example, a patient who's diabetic, Mr. Tony Montana, is diabetic. He's 60 years old, diagnosed diabetes. A week ago, he had a dizzy episode. He felt dizzy. He was driving back then and talked to him, and this is concern. Today is coming for a follow-up, or today is coming because he has a concern. So counseling equal concern. So counseling structure will consist of three parts. Part one, relevant or focus history. So part one, relevant or focus history. So part one is relevant history or focus history. Relevant history dash focus history. Part two is explaining what? About diagnosis, or explaining about his concerns, or explaining about his condition. Part three is management. So three parts in counseling station. Counseling equal concern. So the first part is relevant history, focus history. I will tell you now what is relevant history or what is focus history. The second part is explaining about the patient to condition, or explaining about the reason why he's coming for the visit. The third part is management. Dr. Mo, can you please elaborate? Can you please tell us what's happening? In the relevant history or in the focus history, I will ask only three questions. Only, yes, the patient is diabetic. The patient had developed dizziness a week ago. So when I take relevant history, it will be only three questions. Only three questions. Relevant history. Number one, I will ask about diabetes. Number two, I will ask about risk factors. Number three, I will ask about complications. So, I will ask about diabetes. I will ask about risk factors. I will ask about the complications. This is the first part, relevant history or focus history. Then, explaining about his condition or explaining about what happened, which is the dizziness that he had, which later on we will get to know it is hypoglycemia. I will explain about it. So I will explain all about hypoglycemia. And don't panic, I will explain everything when I give you the example now. Management, I will use arms. ARMS. That's it. So Dr. Mo, can you please give us the example? Tell us what happened. Okay. So the question said the patient was diabetic and he developed a week ago dizziness. He developed a week ago dizziness. So what do you think the presenting complaint is? Why is he coming today? What is his main what? What is his main concern? What is his main concern? His main concern is dizziness, yeah brother. Yeah brother, his main concern is dizziness. So first I said counseling equal concern. So explore the dizziness. Explore the dizziness, which is his main concern. You see, dizziness, I brought it before the three parts. Why? Because counseling equal concern. The first letter in counseling is C, concern. His concern is dizziness. He's not concerned about diabetes. He's coming because last week he developed dizzy attack. So then explore the concern, which is dizziness, in details. So when did it happen? How did it happen? Did you lose consciousness? Did you lose consciousness? Apart from the dizziness, any other symptoms? So that's the main concern. So explore about the main concern. Explore about what brought him for this visit, which is dizziness. By the way, this is just a structure, and every single station will be discussed in details. So after exploring the dizziness, after exploring what happened, and after asking him just before the dizziness, yeah brother, just before the dizziness, what were you doing? Very important question. So after exploring all about the dizziness, then start taking history. So say to him, I can see now dizziness is finished, then I will start. I can see from my note that you have been diagnosed diabetes. Yes, doctor. Is it okay if I have a chat about it? Yes. Then ask about the diabetes. You see? Diabetes, which is the condition, the chronic condition that he has, yeah brother. Ask about the diabetes. When were you diagnosed? Is it type 1 or type 2? What medication are you on? Do you use the medication as it was prescribed? Do you go for a regular follow-up? Do you measure your blood sugar? Is it controlled or not? Then I will go to the risk factors. But before the risk factor, I will ask about the complication because it will fit better. I will ask about the complication. Complication of diabetes, heart, kidneys, numbness in the hands or feet, and vision problem. So I'll ask the patient about vision. I'll ask about the patient about the kidney. I'll ask the patient about the heart, and chest pain, numbness, hand and feet. Then I will go to the risk factor, and in the risk factor for diabetes is DASA. The risk factor for diabetes is DASA. Diet, exercise, smoking, alcohol, and then my history is done. That's it. That's it. Yes, that's it. So I've given you the STEM, and I said to you counseling equal concern. In the STEM, the patient is coming because he's dizzy. So I said to you counseling equal concern. So the concern, what brought him is dizziness, explore dizziness. After exploring dizziness in details, and one of the most important questions is what? Loss of consciousness? Did he lose consciousness or not? And what else? Just before the dizziness, what happened? Just before the dizziness, what happened? What happened just before dizziness, and what else? And the other symptoms of dizziness, all this here in the concern. Then I said to you, you will start by relevant focus history. The patient is diagnosed diabetes. So you will ask about diabetes in details, complication of diabetes in details, risk factors of diabetes. Why do I need to ask about risk factor? Yeah, brother. I will tell you now, later on, because I will use it in management. Always, you get the risk factors to use it in management. So I will ask about the complications, I will ask about the risk factors, and the risk factors focus, DASA. Now I'll go to the second part, which is what? Which is explaining about the concern or explaining about the condition. What is his main concern? Dizziness. So I need to tell him all about dizziness and why did he have it and what is the condition that he developed. So explain about the concern or explain about the condition, which is I'm suspecting hypoglycemia. So explain about the concern dash condition. When you take history about dizziness, he will give you, doctor, I'm from Egypt. I love chocolate, you know. So I went to an Egyptian party they brought plenty of chocolate, so I took too much chocolate and I injected myself with too much insulin. Then I started driving home. Then I was dizzy while I was driving. Then I stopped my car. And when I stopped my car, I had something sugary. Then I became good. By the way, praise him on the fact that he stopped because he was feeling dizzy and he didn't carry on driving. Praise him on it. So now, when you take history about dizziness, as I mentioned to you in details, I said take the detailed history. What happened just before the dizziness? Did you lose consciousness? And he gave you this history of too much insulin. Then when you come to hypoglycemia, when you explain the condition in details. What do you mean, Dr. Mo, in details? Tell him the fact that you had dizziness is because of such and such, which is injecting yourself with too much insulin. That caused the condition called hypoglycemia. Hypoglycemia is low blood sugar. Low blood sugar. The symptoms of hypoglycemia are 1, 2, 3, 4. 1, 2, 3, 4. If you have such symptoms, what to do? If you have such symptoms, what to do? So for example, if you have hypoglycemia, if you have such symptoms, take something sugary. So if you have hypoglycemia, what to do? If you are driving, stop. And now, later on, I will be talking about DVLA. You understand? So explain the condition. Explain the symptoms of this condition. Explain the causes. Why did he have it? It's because of injecting too much insulin. And tell him if this happened, what to do. This is the most important part, which is explaining about the condition. This is the core of the station. If you don't do this well, you have had it. You're not gonna pass the station if you don't explain this part well. As you can see, part 1 is history, part 2 is explaining, part 3 is management. So the core, the heart of the station is the middle part, which is explaining all about hypoglycemia, because the patient needs to know what he has, what is the condition like, the causes. Why do I need to tell the patient about the causes? Because he will need to prevent it later on, so he doesn't have the condition again. Okay? And I will need to tell him if he does develop the condition, what to do. The symptoms of the condition. What to do if you develop the condition. Anyway, and the third part is management. Management in counseling stations, simply I will use ARMS. As you can see, ARMS. ARMMS. A for advice. R for risk factors. M for medication as well as investigation. The second M for multidisciplinary team, MDT, and S for safety netting. By the way, this patient presented to the GP, not to the NE. So some people will say, do we need to admit him? He's in the GP clinic, yeah? So in management, I will use ARMS. ARMS, not just one arm, 2 arms, okay? ARMS, I will use ARMS. A for advice, R for risk factor, M medication as well as investigations. The second M, MDT, multidisciplinary team, or who I will need to involve. So the MDT is basically who I will need to involve, yeah? That's the meaning of MDT, who I will need to involve. MDT, and S for safety netting. But bear in mind something very important. The risk factor and the advice, they will come together. I will tell you how, okay? But you need to have these steps, ARMS. So when I took history with the patient, I found that dizziness was because of what? Was because of too much insulin, for example. So when I took history, because in management, management will all come from history. So when I took history from the patient, for example, he was dizzy because he injected too much insulin, okay? That's the first finding. He injected too much insulin, okay? And when I asked about DESA, he eats fast food and he doesn't do exercise. So one risk factor is too much insulin. When I came and I spoke about DESA, he eats too much fast food and he doesn't do exercise. So how many factors? 3. Too much insulin, fast food, lack of exercise. So when I come to A and R, they come together. R is the risk factors. How many risk factors? I've mentioned 3. too much insulin, diet, exercise. So too much insulin injection, diet is fast food, lack of exercise. So I will say to him like this: as you mentioned to me that you inject yourself with too much insulin, so I highly advise you to take your dose as it is prescribed. So risk factor and the advice, they come together. What do you think about it? You also mentioned to me that you eat too much fast food. Yes, doctor. Well, fast food is one of the reasons why, okay, the patient blood sugar will increase, and one of the reasons why the blood sugar will not be controlled. So I highly advise you to decrease the amount of fast food that you are eating. Is that something you can do? So all the time, have you noticed the risk factor I mentioned and what advice I will give him? So I said to him, as you have been eating too much fast food, then what is the advice? I highly advise you to cut down on fast food. But why, doctor? Because it's one of the reasons why you will have uncontrolled blood sugar. So have you noticed the 3 golden tips that I always mention in management, which is two-way conversation? Yes. As you told me this, what do you think of this? Consent? Yes. Can you do that for me? And why? Why am I talking about diet? Because it's one of the risk factor, one of the reasons why you will not have a controlled blood sugar. So 3 golden tips in management. 3 golden tips in management. Number 1, two-way conversation. Number 2, it's optional. It's not by force. Number 3, consent. And tell the patient why are you doing this. So always in management, advice and risk factors will come together. Always start with the risk factor. As you've mentioned to me this, and it is one of the risk factors for this, I highly advise you to do this. Would that be alright? Then the the M4 medications and the investigation. And here I will talk about medication and the investigation. For example, in diabetic cases, hemoglobin A1C and blood sugar, everything I will do, cholesterol. Yeah. So I will talk about the investigations that I will do, which again, if you follow the previous video, which I spoke about investigations, blood, urine, stool image, again, I will follow the same and I will do my investigations I will need for this case. Medication. Again, I will be talking about the medication. Will you adjust his dosage? Will you increase it? Will you decrease it? Will you give him something else? So again, in medication and investigation part, this is just a structure and every single case will be discussed in details. This is just a structure. So in medication dash investigations, make sure you mention the investigation that is related to the case and the investigation that you will do, and medication as well. Then MDT. MDT is the multidisciplinary team, which means you're senior. Yes, you're senior. And the others that will be involved. Like in this case, for example, diabetic referral. You need to refer him to diabetic clinic. Is there something in UK called diabetic clinic? Yes. Yes, diabetic clinic. There is a diabetic nurse specialist and there is diabetic clinic. So in this case, MDT, which means in brackets, who I will involve in his care. 2 people, senior and diabetic specialist. Then safety netting. Do you remember in the previous video, I have talked about safety netting. I said in safety netting, you need to safety netting about 2 things. Number 1, the presenting complaint. Number 2, the complications. And in this case, the presenting complaint was dizziness, which is hypoglycemia, the reason. And number 2, safety net about complication, which again was the hypoglycemia, complication of diabetes. So in this case, in the safety netting, you must educate him about hypoglycemia. You must educate him about hypoglycemia. Again, the condition, the symptoms, what are the causes or the risk factor for hypoglycemia, what to do if he developed hypoglycemia, and finally talk about driving. Because it's very important here to talk about driving. Okay, this is just a structure. Everything will be discussed, but this is just a structure of how to approach counseling stations. And as used to me, I always like to improve, I always like to work on things, and I always like to add new stuff and new approaches. So thank you very much, and I will see you the second video. Thank you.